Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPAcares. Now, here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm your host, Kyle Longton, and with me today, co-hosting, is someone who's familiar to any of you who have ever joined us for AFSPA Live. It is Maddie Norton from our communications team. Maddie, welcome to AFSPA Talks.
Hi, thank you for having me. So excited to be here.
And Maddie, part of your responsibilities, you help manage our social channels and also our blog. And so I wonder if you can share with us here at the top of the episode, what have we been blogging about this month?
Yes, so actually the week of July 16th through the 22nd is Everybody Deserves a Massage Week. So if you are a member of the Foreign Service Benefit Plan, please take control of those benefits that we offer and get a massage. You deserve it. So we have a blog coming out about that and just the benefits, physical and mental, that come with massages. And related to this episode, we have a blog coming out about UV awareness and just how there's different effects that can happen from UV exposure and UV radiation. Obviously, there's premature aging, eye damage is one. And then, of course, sunburns, which I think me and Kyle have lots of experience with.
Yes.
So that will be coming out this Thursday, or this July 20th is when it's coming out.
Okay, so when you're listening to this episode, you can go and read that blog right away. And one of the things that I think is included in that blog is a little bit about the dermatology program that we partnered with Teladoc Health to offer. Is that right?
That is one of the great benefits that you have being an FSBP member.
Yep. So this is available free of charge to FSBP members. And it's if you're familiar, have ever used the general medicine consultation or the mental health consultation, those are the two most popular, you should know that there's also a dermatology program available to members who are in the United States. This is not available outside the US, at least not at this time, but for members in the US, you can have a consultation with a dermatologist through the Teladoc platform, and that's covered at 100% for FSBP members. And I am actually, Maddie, I'm joining you from Boston, where I'm actually at the Teladoc Forum. And today, actually, AFSPA and FSBP were honored with an award for national recognition for whole person care excellence. And part of that gets into our partnership with them for telehealth needs, including the dermatology, as well as chronic condition management for diabetes, hypertension, and weight management. So all that aside, great job to all of our partners and to our members for utilizing those programs. But I want to get back to the topic at hand. And you mentioned this, that the blog that'll be live when people hear this episode is about UV protection. So
yes,
today's episode, we're focused on skin cancer. And this is personal to me. Both of my grandmothers had experiences with skin cancer. My primary care provider recently, and apparently at the age where I am now going to have the day this episode comes out, have my first consultation with a dermatologist just to check based on that. Because, you know, we mentioned, you and I talked before, my mom visited me recently and sat outside on our deck, and it's 2023, and she still thinks that SPF 8 is sufficient protection. This might explain why I had so many sunburns as a child.
Yes.
What's your SPF number these days?
I bare minimum at least 50. Otherwise, I am red as tomato. So I'm 50 plus if I can have it. Okay. What about you?
Yeah, no, 50 also with the sweat and water protection.
Absolutely.
Just anything that and reapplying every 1 to 2 hours depending on the activity. But yep, and still doing we've got the roll on for our faces now,
yes.
but then the spray on for the rest of the body. And then
Okay.
as a child, I used to swim in a shirt and felt like the biggest dork because I was sunburned so bad. And now, of course, it's the thing. I've got the rash guard and everything else. So I'm doing all that I can to protect myself. Sounds like you are too.
Yeah, we're doing the right things.
Right, because I just remember my grandmothers, they'd have a spot here or there that the doctor had taken care of. And so, you know, coming into today's episode, it's not always been clear to me what we talk about when we talk about skin cancer. We hear melanoma, we hear squamous and basal cell and so forth, and that's about all I know. There's different types, and melanoma is the one we typically think of as the worst. So it sounds like our mothers have failed us in terms of adequate protection recognition. And so I don't know about you, I need some clarity.
I do too.
Okay,
absolutely.
So for today, we have some medical advice to help us in the form of Dr. Leah B. Jacobson, who is an MD, also has a master's in public health, and is also a fellow of the American Academy of Family Physicians. She currently works as a senior medical director in the Aetna One Advocate program at Aetna, and she's been a medical director at Aetna since 2011. After spending some time in the Northeast region and in Aetna's student health business, Dr. Jacobson joined the Aetna One Advocacy, or the A1A division, as the senior medical director in January 2018. Since then, she's built a team of medical directors and has helped create the functioning medical management model for A1A. She spends a lot of her time analyzing data and defining opportunities for additional program development to benefit specific A1A populations. In addition, Dr. Jacobson established and currently maintains the academic style rounds, the A1A clinical staff, and is in the process of working on readmission programs, as well as avenues to engage extremely fragile but unable to reach members. Prior to joining Aetna, Dr. Jacobson obtained her medical degree from Jefferson Medical College in Philadelphia, Pennsylvania, followed by residency training in family practice at the Medical University of South Carolina in Charleston. Dr. Jacobson has been board certified in family medicine since 2007. Rounding out her commitment to population health, Dr. Jacobson completed a master's of public health at Yale University in May 2011 with a concentration in health policy and management. So, Maddie, I'm getting my notebook out so I can take notes during this conversation. So, without further ado, Dr. Leah Jacobson. Dr. Jacobson, welcome to AFSPA Talks.
Hi, how are you?
So glad to have you. I'm doing well today, and I'm excited about our topic. We've been trying to taking the month of July to focus on some sort of summer topics. And last time we talked a little bit about travel insurance on our last episode, and this time we're talking about spending more time outside. And there's been a lot in the news, including just today as we're recording this, about heat exposure and how to stay safe regardless of where our listeners might be in the world. But there hasn't been as much of a focus, it seems, on another threat that comes with increased time outside, and that's the possibility of skin cancer and overexposure to the sun. I have to be honest here. I know there are different types of skin cancer, but that's about where my knowledge ends. So I'm wondering if just at a basic level, we can start with an overview of what we mean when we say and talk about skin cancer.
Absolutely. Thanks so much. Yeah, so skin cancer develops from the skin, and the skin is the largest organ in the body, and it protects us from heat and sunlight and injury and infection. And the skin has two main layers. There's the top part, which is called the epidermis, and then there's the lower part, which is called the dermis. And skin cancer is a disease where cancer cells can form in either of these layers of the skin, in tissues of the skin. And there are three types of skin cancers that begin specifically in the epidermis, which is that top layer of skin. The first one develops from squamous cells, and these are cancer cells that form squamous cell carcinoma. They're thin, flat cells, again, at the top layer of the epidermis. Basal cells are rounded cells, and they're actually underneath the squamous cells, and they are going to form basal cell carcinomas. That's our second type of cancer. The third type of cancer forms from melanocytes, which are the pigment cells of the skin. And these are developing in the lowest part of the epidermis. Melanocytes are what gives your skin color. And when skin is exposed to sun, melanocytes will develop more pigment, and that's what causes you to tan or to change color. And the cancer that arrives when these melanocytes start to form some abnormal cellular activity is called melanoma. So those are our three types of skin cancer: squamous cell, basal cell, and melanoma.
And I want to come back to each of those. You give us a little bit of information, but in a minute, I want to dig in a little bit more about sort of identifying each of those. But before we do, one of the trends that I've noticed when we review data about our Foreign Service Benefit Plan population in recent years is that skin cancer is our most prevalent type of cancer. Approximately 20% of our members who had a cancer diagnosis in the last 2 years were diagnosed with a non-melanoma skin cancer, and then melanoma came in third or fourth on the list. Can you give us some information about the general prevalence of the different types of skin cancer, including melanoma?
Absolutely. Melanoma, well, let me backtrack a little bit. So when we have the development of skin cancers, we talk a little bit about sun damaged skin. And there's something called solar keratosis, which are also called actinokeratosis. And they're really rough, scaly patches on the skin. And we know that if left untreated, a large percentage of these actinokeratoses will actually develop into squamous cell carcinomas. So we think about the ability for our skin to mutate and change a little bit, and ultimately that's where we end up seeing them. There's this first type of sun exposure, and then we kind of change into. So some skin cancers can develop from non-skin cancer type of activity. How common is melanoma? We see that melanoma is, I don't have an exact percentage to give you right now. I mean, the prevalence is, about 4 to 5 million basal cells and squamous cells are diagnosed each year. It's hard to give a prevalence for any specific population, but we do know that melanoma is less common than the basal cell and the squamous cell, probably about 2 to 3 million non-melanoma cancers and about 130,000 melanoma cancers that we're seeing. This is globally each year from the World Health Organization. But ultimately, it's hard to give, prevalence without, actual numbers,
Sure.
Depending on what the denominator is.
Sure, that makes perfect sense. But we're talking about basically 3 or 4 million a year globally. You said, right?
That's right.
For all types of skin cancer. Okay. Well, and so I'm curious, are there certain factors that may increase someone's likelihood of developing skin cancer?
Absolutely. And that's something that we all need to think about. What, when, and how should we present to our physicians? When and how should we look at our skin? So there's lots of risk factors for developing skin neoplasms. UV exposure of sun or indoor tanning is a huge one. A history of skin cancer. So if you've had a squamous cell or you've had a melanoma, you are more likely to have another one. So once you've had one, you need to be really careful about that. And that's true also with family history. So if a parent or a sibling, a blood relative had a melanoma or a squamous cell, some type of skin cancer, you are also at increased risk and should consider being screened. The other thing is age. Over 50, we're going to see more skin cancers. Obviously, the sun exposure, the UV exposure is accumulative. And so the more time you have in the sun, the more age you have, you are going to have a higher prevalence as you get older. Most basal cell carcinomas appear in people over the age of 50. The other thing that we think about is fair skin, the type of skin that we have. People with lighter skin, lighter eyes, lighter hair are also at an increased risk for increased skin cancers. As well as we talked about a minute ago, that was actinic keratosis. Those kind of precancerous types of cellular damage can lead to skin cancers, and also weakened immune system. So if we have specific type of illnesses in certain immunosuppressive medications, that can also increase the cellular activity causing skin cancers.
I had no idea, particularly about that the immunosuppressive and the effect it could have on prevalence or possibility of skin cancer. Thank you. I'm wondering, I'd like to then now go back to something that you mentioned before, because you told us sort of what different types of skin cancer can look like. But I'm wondering if you can go a little bit deeper and help us in terms of understanding how to identify it and how to identify a cancerous or a precancerous spot versus just a mole or a large freckle on our skin.
Absolutely. And I think that's really important. So let's start with the squamous cell. We talked before about the layers. Squamous cell is kind of at the top layer. So let's talk about that first. Squamous cell carcinomas occur, as we talked about, when there's DNA damage from exposure to sun. And it actually can be easily and successfully treated. And the only tough thing is it looks different for everyone. It may look like an open sore. It's rough. It's got kind of a thickened or wart-like type of skin. It has raised growth, usually like with a rolled border, and then we'll have a central depression in the middle. It's persistent and it kind of crusts or bleeds. Sometimes we see people that say, oh, I've had this thing, I think it's a bug bite, but it just keeps bleeding, or I keep going over with my razor and it keeps bleeding, and nope, that's actually not a cut that you keep reopening. That's actually a skin cancer, and the reason why it's persisting is because there's some real significant damage there. You're most commonly going to find these in sun-exposed areas in the body, the shins, the chest, the face, the ears. We're going to see these in areas that the sun is hitting the most. Untreated squamous cell carcinomas can become invasive, and so we do want to find them early and treat them early. Basal cell carcinomas are kind of the next in the layer that we talked about originally. They're the most common form of skin cancer. They grow quite slowly and for the most part are very curable when they're caught and treated early. It also has this kind of rolled edge with a central depression, but it's kind of crusty. It looks like an open sore that doesn't heal. One of the main differences from the squamous cell is it looks shiny. It kind of looks like a bump or like a nodule, like a little node. They can also show up as a reddish patch or kind of just an irritated area. It may look scar-like with like kind of like a yellowish or waxy feeling. So what you're hearing from me is it could kind of look like anything, right? We kind of talked about that with the squamous cell, and we're hearing that again with the basal cells. They've got lots of different characteristics, but I think the key thing when you think about these is that we need to remember that they are anything that's non-healing, anything that is persistent, anything that is either looking like it's irritated or red or bleeding or crusty, that just isn't going away, and that is just, there's no reason not to go in and say, hey, can you take a look at this? When basal cells are left untreated, they can actually become locally invasive, and they can grow quite large and wide and deep, and they can really destroy the surrounding skin and even into bone if they're really left untreated for such a long time. Melanoma is the one that's probably the most important to catch. As we know, these are the ones that have the ability to grow deep into the skin and have the ability to have some significant concerns about their moving throughout the body to become metastatic. Melanoma is really something you should worry about. Is the way you should identify it is any new, changing, or unusual growth in any sun exposed or sun protected body area of the body. Now that goes out the window too sometimes, because we can get them on the bottom of our feet. You can get them in your eye. So you can really get any skin cancer, including melanoma, anywhere on your body. We see them in the genitals. We see them underneath in the hairline. So, just because you say, no, that's a changing mole, but that area never sees the light of day. You know what? You still need to get it looked at because they can see them there. The things to think about with melanomas, we call the ABCDE. So A stands for asymmetry. One half of the lesion doesn't match the other half. So if you look at it, it's kind of irregular borders on one half and the other half is a nice clean circle, or, the color on one side is different than the color on another side. So there's asymmetry mostly within the border or the color. The B is the border irregularity. The edges of the lesion are uneven. They might be ragged or notched. They don't have a clear kind of eraser looking picture to them. They're very irregular borders. C is the color. Typically, multiple colors could be a warning sign. A melanoma can have very different shades of browns or tans or blacks. And as it grows, you could even get reds or blues. So we need to think about dark colors as well as differing colors. One lesion may have browns or blacks, or again, could even have something like a red or a blue color hue to it. The diameter is the D. Anything greater than 1/4 of an inch, or again, to use that analogy of a pencil eraser, if anything is about a little bit larger than a pencil eraser, we need to take a check at it. That's a little too big. And then the E is the evolution. Has it changed? Well, this used to be small and have regular borders, but now it's got 2 different colors and is larger than an eraser. Anything that has changed in size or shape or symptoms of the growth are the types of things that we're worried about with a melanoma.
Okay. And our, most of our folks tuning in or doing this by audio, so they can't see that I'm taking notes of what to look for, because I have my first visit with a dermatologist this next week on the advice of my primary care provider, because of my own family history of skin cancer and so forth. So do you have, we've got some, the ABCDE to help us, any of us who are going into an appointment like that, but do you have any other general information on, what we might talk to either a primary care provider or even a dermatologist, and when we might want to make that appointment? Obviously, if we see any of these warning signs that you've mentioned, that's probably the time to have a conversation. But you mentioned age and so forth. Are there other sort of triggers that you would call our attention to?
Absolutely. So I think, like we talked about, if you've got a family member who's got a history of skin cancer, if you're fair skinned, if you've had skin cancer in the past, if you've got any newer changing moles, generally that's when you would go in for like, I don't know if I'm an emergency visit, but you'd go in for like, what, I'm going to make an appointment in the next week or two, right? But generally, everyone should be screened. Everyone over a certain age, somewhere in the 40 to 50 range, should really be screened annually for their skin. You can go to your primary care doctor, but if you in any of those high risk categories, again, family member, immunosuppressive disease, had one on your own, you really should be going to a dermatologist and doing that, and having a dermatologist do an annual visit on you. They will let you know when to come back if there's anything that's concerning. They may take a biopsy. They may give you some additional feedback on ways to, increase your sun protection or ways to, help with prevention. But generally, anything changes, you should be going in, but annually is really the bare minimum, I would say.
Okay. All right. And so we go in, maybe we've got a spot that we consider suspicious, or the dermatologist recognizes one. You mentioned they might take a biopsy. What are the other things they might do if they, particularly if they identify it as precancerous or even cancerous? What are sort of the treatment steps that might be taken?
Right. So there are some treatment options for skin cancer. Squamous cell and basal cell cancers are treated a little differently than melanomas. They can excise it. So generally what they'll do is they'll take a biopsy and we'll wait for the biopsy results. And then once the biopsy results come back, if it is defined as a squamous cell or basal cell, they might call you back to do additional treatments. They might do an excisional surgery, which means that they will remove the entire thing with some larger borders. They might do something called Mohs surgery, M-O-H-S, which is a surgical procedure that allows the dermatologist, who actually also acts as the pathologist on site, and they will remove the cancer, and they have you kind of go and wait for a minute. They take a look at it underneath the microscope and they say, oh, I need to take a little bit more at 3 o'clock. They'll come back, they'll take a little bit more, you'll sit in the waiting room, they'll look at it under the microscope again, and it's kind of a live feedback on where they need to be removing skin cancer, and lesion in order to get the entire lesion. And the reason why we do Mohs surgery as opposed to an excisional surgery is typically because the Mohs surgery is going to be done in areas where you want to spare skin. You don't want to do a huge excisional surgery on the nose or on the cheek or in areas where it's hard to close skin on the shin or sometimes in the back where the skin is very tight. So Mohs surgery that's what the benefit of it is it takes the least amount of skin while still removing the entirety of the lesion. They also might do something called cryosurgery where they would freeze it. Sometimes they say, you know what, we can hit this with a cryosurgery, and that will be helpful as well. There are also some topical medications that you would get a prescription for. You would go home and you would use them daily for a certain amount of time. That can also be a treatment. So between creams, topical medications, between freezing and other types of cryosurgery, and then kind of some excisional surgeries or Mohs surgery. Those are the most common. There's also some laser surgery or some photodynamic therapies, but generally those are the most common for the basal cell and for the squamous cell. In terms of melanoma, melanomas, again, we talked about it. There is a concern for development of metastatic disease where it has traveled. So typically, they're going to do a surgical removal of the melanoma with large borders just to make sure they've gotten the whole thing. And depending on the staging of the melanoma, how concerning it is, and how the physician wants to kind of follow up on it, there may be immunotherapy or chemotherapy or radiation in addition with melanomas.
Okay, all right, and I think that's what and you've mentioned throughout that melanoma is the one that oftentimes we're concerned about, and its ability to metastasize, and so the treatments for that are going to be a little more familiar to us from other cancer treatments, perhaps. Well, I'd like, if we can, to maybe wrap up on an empowering note for our listeners, and you've hinted at this, but I wonder if you can help us close out by talking about steps that people can take to reduce their risk or even prevent skin cancer.
Yeah, absolutely. I mean, I think that the key thing to skin cancer, we talked about skin cancer is the most common cancer in the United States. 1 in 5 Americans are going to develop skin cancer in their lifetime. And, it's something that we need to start thinking about when we're extremely young. We need to think about it with our kids. We need to think about it, every time we step outside. Since the exposure to the sun's harmful UV rays is the most preventable risk factor for the skin, we need to protect our skin mostly from the sun. Seeking shade, wearing sun protective clothing, applying sunscreen to all skin that's not covered by sunscreen. There are 2 types of sunscreens. There's physical sunscreens and there are chemical sunscreens. Physical sunscreens would be things that would work like a shield. It would sit on the surface of your skin. And these are, very significant screens like zinc oxide and titanium dioxide are really what you want to look for when you look for sunscreen. You want to look for zinc oxide and titanium dioxide. These will, deflect the sun's rays, right? Chemical sunscreens are a little different. They work in a way where they actually absorb the sun's rays, and these they're a lot easier to rub in. They don't leave the white residue, so people tend to prefer them. This is your oxybenzone, avobenzone. These are good, and they're better than nothing, but the zinc oxide and the titanium dioxide is what you really want. You know, as long as it's a broad spectrum, water resistant, 30 SPF or higher, you're good. I think you have to apply it every 2 hours or after you've been swimming or sweating. But what you really need to think about is putting that chemical or physical sunscreen on you as often as possible. And then having certain types of physical barriers in addition, such as, you know, wearing a hat, wearing long shirts when you're out in the sun, and those types of things. But I think that's really important, especially for children, right? Sunglasses will block UVA and UVB. A hat with a brim all the way around will shade your ears and your face and your neck. And finding shade under an umbrella, under a tree. And if you must go out in the sun, again, we're looking at the titanium dioxide, and we're looking at the SPF greater than 30. And you have to remember too that even if it's a slightly cloudy or a cool day, there's also a lot of sun, you know, getting through. You know, staying away from tanning beds is another really big one. The World Health Organization has actually declared indoor tanning devices to be cancer-causing agents, the same category as tobacco, and they can increase the user's risk of developing cancers by, you know, anywhere from 20 to 50%. So that's really, really concerning. And again, the right sunscreen when you do go out. I also think something to remember is if you see something, you should say something, right? So examine yourself, no matter what your risk is, examine yourself head to toe, open up, you know, open up all the in between your toenails and in between, you know, your fingers, underneath your toes, look everywhere. And if you have anything that's concerning, just say something. When in doubt, go get it checked out. Skin cancers are most dangerous when they are advanced, and most skin cancers, if you catch them early, they're treatable. And so you need to get your dermatologist to take a look, and then you need to follow up regularly as they define appropriate. So I think it's really important, you know, to make sure that prevention is really, really important here. And I think it's good to think about for yourself and your family.
Okay, that's incredible advice. Thank you. And I've learned a lot today. We covered a lot of ground, and I'm just before we close out, is there anything else that you'd like to share that we didn't already have a chance to cover?
You know, no, I think speaking with your primary care physician, speaking with your dermatologist is going to really reiterate a lot of the points here. I think I am not a board certified dermatologist. I am family practice trained, and, you know, I do in practice, I did a lot of skin checks and a lot of referrals to dermatologists. So I think it's important to know that your physician is really going to be very helpful in identifying things for you. So even if you're there for, you know, a hurt ankle, say, hey doc, you know, I've been noticing this thing. Do you think I should get this checked out? And they can help you. So definitely don't sit on things that you think could be concerning.
Excellent. Well, Dr. Jacobson, thank you so much for sharing your expertise with us today. I really appreciate it.
Thank you. Appreciate you asking me to come.
Thanks again to Dr. Leah Jacobson. Dr. Jacobson will actually be joining us on Thursday, July 27th at 11 a.m. Eastern Time for our monthly live broadcast, AFSPA Live. Join us then to ask your questions on YouTube, Facebook, or through LinkedIn, or you can submit questions ahead of time to outreach@afspa.org. If you prefer, you can call and leave us a voicemail at 1-888-435-0757. Keep up with all our upcoming events by visiting our events calendar at afspa.org/events. Thanks for listening, and be sure to subscribe to AFSPA Talks to catch our next episode. Please rate and review us on your favorite podcast app and share your feedback with us on Facebook, Instagram, or LinkedIn. Search for @AFSPA Cares. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPACares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.